Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States. Let's look at our globe and rotate it and find out if it is going to come to the right place in the United States. No, where is it? Somewhere in the Pacific. But anyway, I'm in the United States, New Jersey, so we're going to talk about today. We've been doing a series of videos on before you go to the lab, it's important to know what kind of things need to be done, right? Otherwise, what's going to happen to majority of my patients, the problem is they go to one lab and get the lab results and it may be something abnormal, and the first thing, what is the first thing they're going to say? They blame it on the lab, right? And then they go to the next lab, maybe 5 miles from where the other lab, get another lab checked out, and they try to blame that lab also, then keep on. There are some patients go to 3 to 4 labs before they come to the doctor. So it's better to be prepared and get all the things needed to be done before you go see the lab, before you go to the lab in the morning or like whenever, okay? Today our topic is about fasting blood glucose. Okay, what are the things you have to do before you go to the lab? The first one, should I fast for the test? Just like fasting blood glucose, right? You have to fast. But the question a lot of people is like, how long should we fast? Minimum 8 hours, 12 hours. So I would say fast 12 hours if you can. Okay? So the next question is like, what food I should avoid before the test? I'm talking the night before, okay? We always get the fasting blood glucose in the morning. So the night before you start your fasting, make sure you don't take high carbohydrate or sugary foods, especially white bread, pasta, rice, sugary cereals, candy, chocolate, sweetened yogurt, and all that you should avoid, okay? Now, what time should I take this test? Always go in the morning. I think it's better because, it doesn't affect. Otherwise, how are you going to fast all day and then you might get dehydrated and all that. So take the lab test in the morning because the cortisol level can affect also your blood sugar level. That's why you do an overnight fast and go get the labs in the morning, okay? All right, let's look at the next question is like, should I exercise before the test? No, don't do that. Don't wake up in the morning, 5 o'clock, do your like 1 hour, 2 hour exercise, then go to the lab because you can, when you exercise, glucose can enter into your cells and all that. You don't want that to happen. So you want the normal, just whatever you've been doing normally, you do that. Don't do anything kind of extreme, okay? Can I smoke before the test? Absolutely no. Stop it. Like, if you're a smoker, 24 to 48 hours, nicotine can increase your blood sugar. Okay, so don't do that. Now, can I drink water before the test? Yeah, you can drink water. It doesn't usually affect your blood sugar level. Okay, but if you are like, I would say like, be careful drinking milk. It can affect on it. Okay, does stress or lack of sleep affect my blood glucose test? Okay, so make sure you get good night's sleep and make sure you're not stressed out because, if you don't sleep, well, your hormones kind of messed up and a lot of this kind of stress releasing hormones are there. Body release a lot of hormones when we get struck. It can affect your blood sugar go up. Okay, so make sure you get good sleep, less stressful. Can I drink coffee or tea before the test? No, you can raise your blood sugar level. Don't do that. Just drink water. Can I drink alcohol before the test? No way. Don't drink alcohol. I would stop it in like 24 to 48 hours before because it can increase your blood sugar level. Does medication affect my blood sugar? Of course it can affect. Be careful. The first one, if you're diabetic medication, it could affect, right? But that's okay, as long as your doctor knows about it. If you're taking steroids, like a lot of people sometimes get some respiratory breathing problem, they may be on steroid. That can increase your blood sugar. Some people maybe, I know like some doctors put for back pain, they might have given, that can affect the blood sugar. Beta blocker, diuretic, antidepressant, all of them can increase your blood sugar, okay? I'm not saying like you should stop it, but always please check with your doctor first. Okay, now what are the over-the-counter medication you never think about can affect the test? Okay, decongestants are the main thing. Pseudoephedrine, phenylephrine, in the cold medication, cold and allergy medication can affect your blood sugar. Stop doing that, and can stimulate the nervous system, raising the blood sugar level, okay? Even the pain relievers, NSAID, acetaminophen in high doses, can interfere with the blood glucose metabolism. That can affect cough syrup and liquid medications. You have to be careful. They usually have high sugar content. A lot of people don't know that, the cough syrup. So avoid cough syrup. Caffeine supplement, increased stress hormone. Like everybody's taking the supplement caffeine, but don't do that. The last slide we're going to talk about is like what's the difference between fasting blood glucose and random glucose testing. Okay, whatever we talked about today is fasting blood glucose. You fast for 8 to 12 hours. Random, you just check it whenever you want it to. Okay, so overall, be careful before you go to the lab. Make sure you follow this advice so you don't have to repeat it, or it doesn't give you a headache when there's no abnormal lab results come back. Those are the main purpose we make in the video, to educate the public. So when you check the lab, you get the correct lab results back. Now, if you like this video, please subscribe, share, and send it to your friends. And so we like to continue producing more videos like that. Thank you so much for your support. God bless.